Hey everybody, Chris Coleman here, certified hand therapist, and today we're going to talk about arthritis. That's right, good old Uncle Arthur, as it's referred to from many of my patients. And arthritis is just the wearing out of your joints. Normally there is a nice spongy material between a lot of those joints, and they just end up wearing out as we progress in life and as we beat them up. Typically in the human body you see a lot of knee arthritis. That's why you have knee replacements, hip arthritis, that's why you have hip replacements. But in the upper extremity, we see the most one, at least I see, is that at the base of the thumb, your CMC joint, you get CMC arthritis. So we're going to use this little model that I have here, and we're going to show you. Those would be the bones that are underneath. And right here at this joint of your thumb, your CMC joint, carpometacarpal joint, is where you end up seeing a lot of arthritis and breakdown. So why does this happen? So typically, we don't have any control over this. This is the cartilage which sits in between the joints. It is that cushion, and it absorbs some of those forces so you don't have bone on bone. But what we end up doing is we end up wearing a window through that cartilage, and you get the bone on bone. Best analogy I've come up with in my years of practice is it's much like brake pads. When you get a new car, the brake pads are brand new, and they work pretty well. If you drive the car real hard and you end up wearing out through those brake pads, you get that metal on metal sound, and it's kind of like bone. It's the same thing as bone on bone. It produces pain in the human body. And unfortunately, there's at this point in time, there's no real way to prevent it. It usually is a genetic quality to the tissue that you have. So if you're blessed with good genetics and resilient tissue in the cartilage, it usually doesn't break down. But many people are not, and as we live longer and longer, we end up wearing these things out, and you start getting some arthritis. So especially in the hand, things that affect the base of the thumb, anything we pinch with what we call a lateral or a key pinch, just like we hold a key. We pinch like a 3-jaw chuck, where we pinch like this, and we pinch with a 2-point. Those are most of the things that we do. So also holding things, if we hold a jar or a can and we push against it and that thumb ends up being a post, it hurts. And as we do things, so toothpaste, writing, cans that we twist and open, using our smartphones, there's another one that hurts the thumbs. People who knit get a lot of problems in there because not only are they pinching things, but they're twisting their wrists as well. So anything you do, and I'm sure if you have arthritis or some pain at the base of your thumb, you know exactly what these things might be that wear out and hurt this tissue and ends up causing pain. Problem is that then we start avoiding lots of things. We start avoiding things we love to do because they hurt to do. So that's no good. That's why I'm here. That's why I'm here producing this video. I want to help you with some of those things. And give you some strategies that I've learned. So some of the things that you can do for yourself, and this started a number of years ago actually when my mother, who is an avid knitter and has knit me sweaters and had most recently knit me some great socks that have kept my feet warm here in the winter. And she was having some pain at the base of her thumb. So we got her a specific splint that I really like, which allows her to do some things but still have some 20 to 30% discount in her pain because of using it. We gave her some home strategies on how to ice and heat that will help, and we gave her some behavior modifications so she doesn't do things for 6 hours, she breaks them into little time periods. And all those things have allowed her to continue with her knitting and still manage the condition. Now I'll tell you, having done this for 20 years now, 2 decades, there's a lot of crap that's on the market as far as splints you put on, as far as home remedies. Everyone's got an opinion when they try and sell something about that what they've made is the greatest thing in the world. So I've kind of teased through a lot of those things through trial and error in some cases, and in some cases just using common sense and knowledge that I have, where I've got some very specific splints that I like to recommend to people, and I do recommend to people. I've got some very specific things to do at home as far as modalities and things that you can use to help relieve the pain and irritations when you flare it up. And we've also got some specific things about how we do some exercises and things that I like to do that have been proven with people to really help them through and allow them to continue on with what they like to do, and not have this be such a horrible thing that you have to avoid lots of things because of the soreness. Arthritis is something we certainly cannot cure, but we can help manage the condition and get you to the point where you can still continue to do the things that you love to do. There's also some over-the-counter supplemental things. Glucosamine is a big one that you hear about that people like to take. And just like I was talking about with the splints and things, there's some things on the market that are just out there because people want to buy them and they aren't that effective, in my opinion. And then there are some other things that I think are really good and very good for that condition as well. So if you have any questions, or you suffer from these things and you want a little bit more advice on maybe what specific splint to get, specific exercises, specific supplements maybe that you can take, and some modalities and things that you can do to help your hand, please reach out to me, jchriscoolman@gmail.com. You can check the description for that email address as well. You can correspond with me. I have given a little bit of advice here, but I don't want to go too deep because your specific needs are probably going to be different than somebody else's. I don't want to recommend one thing specifically because, like I said, there are a number of different things that we like to do, or I like to do, for this condition, but I need a little bit more information before I can give you some specific things that I want you to get, because I don't want you to get the wrong thing. And so you can also visit my website at helpforthehand.com. It's got a blog about this arthritis, and it's got some nice pictures to kind of show you exactly what's happening and what we're trying to do here. So please feel free to reach out. Happy to help you. This is a horrible condition that affects a lot of people because the baby boomers are getting older, obviously, and as they advance in age and we live longer, we just end up wearing out the machine, especially here at the hand. So thank you very much for watching this video. I appreciate your attention, and contact me if you need any help.